So as you can see on this PowerPoint slide, am I blocking anybody's view okay?
Yep.
So this is what we're talking about when we say that we have a quasi-monopoly of 4 big insurance companies. You can see this is the health insurance market share based on premium revenues for 2010. So you can see on top there to the left, Blue Cross Blue Shield has 31% of the market share. That is, they get 31% of all premium revenues in the state of Minnesota, and they have 2.5 million members. Then to the right, Medica has 22.7% of the premium market share, and they have roughly 500,000 members. And Health Partners at 20.3% of the premium market share, and they're at about 400,000 members. So, you know, we're talking about, and then UCare at 12.9% market share. If you add all that up, it's close to 90%. 90% of the market share. That constitutes an oligopoly, or what you could call a quasi-monopoly. And that's the proof. This slide right there proves it, that we need a change in Minnesota. We need an alternative to level this monopolistic playing field. And if you add up all those members, it comes out to over 90% of anybody insured in Minnesota is currently insured with one of those 4 dominant health insurance companies, HMOs. Now, to talk about their profits, HMO net income, or profits from operations and investments, in the last 20 years, 1990 to 2010. I think the slide speaks for itself. You can see on the left column there, in hundreds of millions of dollars, that the HMOs collectively, the big 4, have reaped tremendous profits over the years. From 2001 on, we're talking collectively over 100 million in profits. These are supposed to be nonprofit organizations. What is happening with this excess? The excess, 100 million and so forth, 150 million, and in 2010, almost 250 million, is supposed to do one of 4 things. It's supposed to go towards lowering premiums. Is there anybody here who's ever had lower premiums in their insurance renewed every year? I don't think so. Or it's supposed to improve benefits. I never see anybody get a letter from their insurance company saying, "Oh, we're going to improve your benefits this year." Or it should those surpluses every year should be going towards improving the quality of care, and actually the quality of care is deteriorating because of the inefficiency of the insurers. And finally, surplus should go into things like creating greater efficiencies, economies of scale, and improving operations, which the insurers have not been able to do. In fact, the term is that insurance have legacy systems, and we're actually the first people to actually raise this, I think, in Minnesota. We talk about the administrative sciences, about how fragmented and complicated everything is to understand in terms of policies and out-of-pocket payments. But operationally, these insurers have very cumbersome systems that oftentimes are not updated, and these are called legacy systems. And as a startup, we're actually in a position where we can be very innovative, and as Rakesh and David said, use the latest high technology and information systems to manage enrollment and provider network. Next slide. This is the biggie here. This is the big controversy now that's under scrutiny, both under federal hearings and state hearings. Excess financial revenues of HMOs contracted by Minnesota healthcare programs. This is the biggie here, where they reap the most profits. And I'm going to come up here and show you, so that obviously insurance companies need to have substantial reserve funds, or what's called solvency funds. Roughly, they need about 2 months of claims payments. In case for some reason the premium revenues are not coming in, they need to be able to pay those 2 months of claims. And so this fancy term here, risk-based capital, is at 200%. This is the minimum that you really need. This is actually an industry benchmark. Between 200 and 250% is the amount of capital, reserve funds, that an insurer really needs. And that, which really comes out to about 2 months of claims, okay? And so you can see here that that would be at this level here, 77 million for Medica, 62 million for Blue Plus, which is essentially Blue Cross, 109 million for Health Partners. This is what they have, right, on hand in their banks. And UCare at 70 million. Now, here is the actual amounts of reserves that the profits that I was just showing you go into, that are then invested and not put back into the 4 components that I was just mentioning. And so Medica's is all the way up here at 1,000% of risk-based, what's called risk-based capital, a reasonable reserve, fund, in other words. So they're way up here, and so that excess comes out to 240 million. Similarly, Blue Plus, which is essentially which is a subsidiary of Blue Cross Blue Shield, they should be down here. They're all the way up here at 762%. All right, you should be between 200 and 250%. They're at 762%, and that's in excess of 113 million. And so on with Health Partners, excess 143 million, and UCare excess 62 million. And if you add up that excess, we're talking about $750 million actually currently in reserve funds that should actually be given back to communities in terms of lower premiums, improved benefits, higher quality care, and more efficient operations. For the next slide, this one's slightly, I'd like it to be a little plainer than it is, but it's to show, this is the government programs where the insurers really reap the most profits, because our tax dollars are actually doing a lot of the administrative things that they don't have to do. And this is an issue that really needs to be brought out. But I'm just showing you, these are the 87 counties that the insurers operate. And so in the counties that are in blue, there's only one plan choice, okay? Well, Governor Dayton's saying, well, we're gonna have the insurance companies compete for contracts now. Well, when you only have one plan choice in about 25 different counties, one insurer cannot compete with itself, right? I mean, that's just ABC. So I'm just trying to give you an idea that you need more insurers in this marketplace, and that's what Co-op Care can do. Similarly, in all the counties that are red, this is the map. This is the map of how you really look at these marketplaces. Even all the counties with only 2 plan choices, and in the rural areas, that tends to be Blue Cross really dominates the rural areas, and so does Medica, and I'll be showing you that. So that's what I wanted to point out here. Even 3 plan choices in the counties in green. You really need it. You need at least 4 insurers to have any kind of possibility of competition. But if you don't have, if those 4 insurers, they have to each represent 400,000 members, and if they don't, it's very difficult to have a competitive marketplace. There's really good studies on this. So that's what I wanted to point out here, is essentially that a big insurance company cannot compete with itself. So this gets into the specifics of the health insurance exchange market, because it's for individuals, and I'll be showing you another slide of the small employer group. So basically, in the individual market, you have 255,000 people, and what I'm trying to point out here is that in the individual market, it's completely dominated by Blue Cross Blue Shield. They enroll 160,000 of that number. That comes out to 63% of the market share. And then Medica is second at 12%. Health Partner, well, Time Insurance Company, Health Partners is at 8%. So, I mean, if you, the top four here, that comes out to, you know, what, 63, 75, about almost 95% of the market share is for big insurance companies again. So, again, the same point we're trying to make here is a quasi-monopoly. And this is the actual market for individuals that will be on the health insurance exchange. Similarly, for small employers, it's the same situation. Not quite as bad, but Blue Cross Blue Shield of Minnesota controls 40% of the market share. Medica controls 23% of the market share. Health Partners, 22%. So we're talking 85% of the small employer market, and this is specifically the market that we're talking about for the health insurance exchange. These are the people who are eligible for the health insurance exchange. When only 3 insurers control 85% of the market share, the benchmark, as you may know in economics, is whenever you have 4 dominant businesses in anything, if they control only 40% of the market share, prices increase, quality decreases, and frankly, they get sloppy. But we're not talking 40%. It's called the 4-firm concentration ratio. We're talking 85%. And finally, we've been talking about how the dominant insurers have ratcheted down reimbursements to practitioners, to all practitioners. Lately, the focus has been on dentists. We wanted to have a dentist speak today, but we couldn't get anybody for today. We do have a written transcript, though, from somebody. But as a pharmacist, I want to point out that back in 1994, this is when the big mergers took place, so that to create the big 4 insurers: Blue Cross, Health Partners, Medica, and UCare. And back then, pharmacy dispensing fees, were roughly over $3.50 per prescription. Now, the cost of dispensing studies are very clear that to dispense 1 prescription costs at least $10. If you look at overhead and administrative costs, labor, keeping the lights on utilities, all those kinds of things. So even then it was way below our costs, and actually medical assistance was paying us the highest amount. So that was ratcheted down the year after the big Minnesota Care HMO bill was passed that created all these mergers. And that's when it all started for creating the big 4. Our fees were ratcheted down, and they have not increased since. In fact, they have not increased for inflation, and here's where they're at today. I mean, some insurers pay nothing, actually, for a dispensing fee. Medical assistance, the state government program that's not contracted out to private insurers, at least pays $365. So what is the result of that? So if you look at chain versus non-chain pharmacies, non-chain meaning more or less independent pharmacies, that ratcheting down of our dispensing fees actually causes independent pharmacies, which used to be on almost every street corner and is just the hallmark of American culture, one of the hallmarks. And so back in '96, we had 550 essentially independent pharmacies, and so since then, now we're down to 400. So we're talking 150 independent pharmacies have closed, and of the ones that are left, there's only 400 in Minnesota now. Most of those are in the rural areas. You can barely think of an independent pharmacy that's in existence anymore in the Twin Cities, particularly in Minneapolis. I mean, they've just been closing everywhere. Birch Pharmacy in Uptown is the latest example of that. So this is the concrete evidence of what happens to a marketplace when it's dominated by 4 major insurance companies. And we need an alternative to that, and we think that alternative should be co-op care. And I'd like to close this press conference with a little video that we put together